Hi everyone, my name is Dr. Ilman Ahmed. I'm a physical therapist, and in my YouTube channel I want to go over certain concepts that's going to help you with your NPTE exam. And as you know, it's an exam. NPTE exam is an exam that you need to get your license here in the US in order for you to practice as a physical therapist. So in my first video, I want to talk something about first CMC joint, which is a saddle joint. This first, second, third, fourth, fifth. I want to talk about the first CMC joint today. It's a saddle joint. As you know, this is flexion and this is extension. Flexion, flexion, extension, right? And your abduction is like when your thumb goes to this side. This is your abduction. And this is adduction. Abduction, adduction. So what's happening here is that when you're doing flexion and extension, your roll and glide is concave and convex, meaning it is exactly on the same side. For example, look what happens when you're going into flexion. Your hand going into ulnar side. Do you see that? But when you're going into extension, your hand is going into your thumb is going into radial side. So if you want to increase thumb flexion, you have to give ulnar glide. Look where your hand is going. Wherever your hand is going, that's exactly the glide that you're giving. For extension, thumb extension, you need to give radial glide, right? But for abduction and adduction, it's totally different. For abduction, it is convex on concave. So now look, for abduction, my thumb is pointing volarly meaning anteriorly. So you need to give posterior glide in order to increase abduction. But for adduction, look what's happening. For adduction, my hand is going into dorsally, which is going into posterior side, right? So I need to give anterior glide to increase adduction. But for abduction, since it's rolling into anteriorly, I need to give posterior glide. And but for adduction, since it's rolling into posteriorly, I need to give anterior glide. Okay guys, so I have one practice questions that I would like you to solve. So please check that out. I'm going to post that question in the comment below. Try to find the best answer. But before we wrap up, I want to share another mnemonics that helped me to remember which glide that you need to give to increase abduction and adduction. Remember pad and dab, palmar interossei muscles. What do? They adduct the fingers. Dorsal interossei muscles. What do? They abduct the fingers, right? And how do we remember that? Dab and pad. That dab and pad, that mnemonic holds especially true for CMC abduction and adduction. So for abduction, remember dab, dorsal. So in order to increase abduction, you need to give dorsal glide, DAB dab, which is also called posterior glide. And in order to increase adduction, you need to give what? Pad. You need to give palmar glide or anterior glide. And for flexion and extension, remember in whichever side your hand is going, that's the glide that you have to give. For example, for flexion, my hand is going into ulnar direction, right? So I need to give ulnar glide. For extension, my hand is going into radial glide, right? So I need to give radial glide. So why? Because flexion and extensions are concave on convex, whereas abduction and adduction, they are convex on concave. So we need to give opposite glide. And again, to wrap up again, abduction and adduction, remember pad and dab. And for flexion and extension, remember ulnar glide and radial glide. Hope that helps.